And I've just been collecting these bills and looking at them over the day. It's remarkable. You have someone goes into the ER because he has an injured wrist, fell and hurt his wrist, got a bill for $10,655. A woman named Linda in Illinois, she had twins via C-section, was in the hospital for 2 days. Jessica, $38,000. A lot of money, no question, on these bills. And it kind of leaves people scratching their heads. How exactly these bills get so high and what are we being charged for? Decided to go straight into the operating room and take a look. This is the hospital where I work, where I'm a neurosurgeon, and just having an operation performed in a room like this costs about $3,000 an hour. That's for starters. Come on in. Give you a couple of quick examples. If you look at a hospital bill, you might see an IV bag charge. It's an IV like this, about $280 just for the IV bag. That might strike people as very high. A stapler. This is a stapler that's often used in surgery. Something like this costs about $1,200. And like everything else I'm going to show you, it's used once and then thrown away. Now keep in mind, all these prices are what you, the patient, are getting billed for. It's all itemized. Hospitals buy these supplies at cost and then, like a retailer, mark it up at a higher price to charge for. And you'll find examples like that really all over a room like this. Suture, something that's used in just about every operating room in the world. This type of suture over here costs about $200. And if you look at even devices like this is a needle that's used for biopsy. So if there's a concern that someone has a tumor, they would use a needle like this, and this is going to cost about $800. Now, it's important to keep in mind, if you ask the manufacturers of a device like this, why so much money? They'll say, well, it took years to develop something like this. The research and development costs are significant. Also, they're guaranteeing a certain level of effectiveness of this needle. That costs money as well. But something maybe you didn't know, when you look at a hospital bill, it's not just the cost of the supplies. There's also administrative costs that are built in. There's the cost of covering people who simply don't have insurance or can't pay. That's built into these costs as well. And finally, keep in mind that what is charged and what is ultimately paid are two very different numbers. You know, what we hear a lot as well, Jessica, you know, the billing, for example, for every dollar, only about 4 cents in some of these hospitals is collected. So a lot of these hospitals, you know, I mean, there's a lot of finger pointing going on saying, hey, it's not the hospitals that are making too much money, the manufacturers may be charging too much money in the first place. In fact, if you go back and you look at hospitals around the country, about half of them are currently operating in the red. So we decided to go to the manufacturers, the makers of a lot of those supplies you just saw, Jessica, and in fact, many of them are doing okay. 3M, for example, makes a lot of medical equipment. They had about $800 million in profits last recorded. And also a company known as Medtronic. They make a lot of supplies, including defibrillators, which we've been talking about quite a bit recently. They had about $900 million in profits last recorded. So you got to sort of follow the money along here. But it's interesting for people to take a look at their bill and really break it down, Jessica.